Hi, I'm Dr. Vincent DiPasquale, the owner and CEO of Orthobiologics Associates, the Center for Integrative Healing. We have practiced in the regenerative space for over a decade and have helped thousands of patients from all over the world overcome serious orthopedic injuries and orthopedic concerns without the use of drugs and surgery. We have treated celebrities, professional athletes, and even a billionaire using our protocols, and I'm extremely excited because now we can offer access to this technology for individuals just like you. First and foremost, it's never my decision, and I don't tell patients what to do. It's your body and ultimately your decision in terms of what tools you want to utilize to help you achieve your goals. However, it is my duty and obligation to help educate you so that you can make an informed decision as to which tools would be necessary to help you achieve the outcome you desire: long-term relief and getting back to doing what you love. If you're like many of our patients, then you recognize that drugs are a short-term solution that have the ability to only manage symptoms, and surgery may not be the very best option to promote long-term health and get you back to doing what you enjoy and improving the quality of your life. I'd like to introduce you to regenerative medicine. It is a modern technology that has been in practice for many years and has helped countless people achieve that very outcome. It is important to recognize that the tools that we have at our disposal are very different than the ones present in the traditional orthopedic model. So I'd like you to consider an analogy. In the traditional orthopedic model, they have axes and they have fire hoses. Consider them the fire department. And yes, during periods of crisis when things are completely broken or your house is on fire, then axes and fire hoses make sense. However, once the fire's out, axes and fire hoses will never rebuild the house. So what we need to consider are tools and resources in a repair and maintenance model that can ultimately restore your house to its pristine condition. The difference here is that while the traditional model focuses on reducing symptoms with drugs and surgery, in a regenerative model, we focus on healing the root cause of those symptoms, which is the damaged tissue that's causing it. When we do this, not only can we help patients achieve long-term pain relief, but we can also prevent future arthritic processes from developing. So what is regenerative medicine and how does it work? The word regenerative is kind of a misnomer. It appears as if tissue is regenerating, but it's through a very natural healing process that occurs in the body. So I want you to focus on what I just said, the term healing. What regenerative medicine represents is an ability to heal damaged tissue. You're already familiar with this process. If you've ever cut your hand or skinned your knee, then you know that your body has a natural and powerful ability to heal. However, that healing ability only resides in large peripheral tissues like skin, muscle, bone, and fat. So I'd like to draw you a picture. Really very straightforward. It just helps us understand what the natural healing process looks like and why what we do can have a great impact on your overall condition. So if we take a look at this whiteboard, so basically this is a cell, this square here, and these squiggly lines in red are capillaries. And the reason I mention that is really simple. These particular cells lie dormant in our large peripheral tissues, and they live on capillary networks. And this is an important piece of the puzzle. When we're talking about orthopedic conditions and damage to dense connective tissue like ligaments, joint capsules, cartilage, and discs, those tissues don't have a very good blood supply and therefore don't contain the inherent capacity necessary to heal like other tissues in our body do. So if I cut my hand, let's say, using that as an example, let's imagine that this is an injury. The first thing that happens is that particular tissue produces a chemical signal. Our body is made up of signals. That's how our cells communicate with each other. We have hormones, we have peptides, we have the inflammatory process. This is called a chemoattractant, right? So it's a chemical signal that basically starts the inflammatory process in response to injury. That inflammatory process turns this particular cell, this dormant cell, into what we would call a mature stem cell. Okay, stem cells do not do this, and this is an important piece of the puzzle. I want you to understand that this is not a growth or proliferative process. It's the same reason why if I cut my hand, I'm not going to grow a thumb out of my hand. It's not generally how it works. The mechanism by which stem cells can heal is essentially that these are intelligent vessels, right? They're intelligent because they can recognize the signal that's produced by the damaged tissue, and they understand what type of tissue it is. They can recognize a wide variety of tissue because they have cell receptors that are responsible for that. And when I say that they're vessels, well, vessels carry things, right? And in this case, what they carry, once mature and active, are growth factors. So basically, once active, they'll sit in space and they'll secrete growth factors on behalf of the tissue. And as a result, the tissue will heal itself. So these cells will remain in place until the tissue has healed to completion, and then they'll kind of revert back and they'll fortify tissue, make it stronger. So what I'm drawing for you and what I'm trying to express is simply the natural healing process that occurs in our body. Now, as I mentioned before, the dense connective tissue that's typically injured in orthopedic issues, the ones that give us the long-term residual symptoms and dysfunction, the ones that we want to get rid of, unfortunately, our body doesn't have the capacity to do this in those tissues. So what regenerative medicine really represents is very simple. We have the capacity to transplant these from an area of abundance where your body makes them, the reservoir, where you won't miss them. And we can take them from that area of the body and then put them where they're needed and give access to the damaged tissue that requires healing. It is done on an outpatient basis. It is a minimally invasive injection protocol, so there's no downtime, there's no need for recovery, and patients can generally go back to work within a day or two. For that reason, there are very little risks associated with this process. However, healing does take time, so it is a time-dependent process. If you can imagine an analogy, really simple. Let's say we're trying to build a house, right? We have an empty plot of land. My job is to drop off construction workers and raw materials. As a result, they will do the work for us and they will build the house over time. It's not built in a day, it's not built in a week. It takes a little bit of time for that to be constructed. But at the end of that process, the house doesn't disappear, so it doesn't wear off. So this does provide us with a certain level of permanence to recovering from these types of injuries. If you're interested in this type of therapy, in this type of care, you can find out more information at orthobiologicsassociates.com. There's links to articles and research. You can meet our docs, and you can look at some of the conditions that we treat that we may be able to help you with. You can also give us a call, and we can basically schedule a case review and a consult where you can talk directly with me, and I can go over whether or not this particular intervention is right for your particular situation. I appreciate your time. Thank you.